Longwood Pediatrics was founded more than 75 years ago by a group of pediatricians in the Longwood medical area who practiced at Children's Hospital and oversaw the care of newborns at what was then the Boston Hospital for Women Lying-In Division. In the 20-plus years I've been here, there has been a lot of change and a lot of improvement that I think really makes Longwood Pediatrics a very, very good place for a child to get pediatric care.
We have 10 doctors and 4 nurse practitioners that are actively seeing patients. We are very actively engaged in building a medical home for our patients and work very closely with the PPOC, which stands for the Pediatric Physicians Organization at Children's Hospital. When I talk to new patients and try and tell them why I think Longwood Pediatrics is the place for them, the main thing I tell them is that we have office systems that are well designed to care for children. We have a wonderful nursing staff that we work very closely with, and we are always available to our patients by phone, through our patient portal.
With the enhancements to our space, we've been able to create a facility where the experience is not only warm and inviting, but at the same time much more efficient. It's much more patient-centered. Once the patient's brought into an exam room, everything that needs to be done can happen in that room. And it's much more relaxing, it's calmer for the kids, it's easier for their parents, and it really lets us do a better job.
We take a lot of referrals from other doctors for their patients and for their own families and friends. Likewise, being right across the street from Children's enables us to see and take care of our own patients who are hospitalized. So if I have a patient with asthma, for instance, that I've taken care of for years and they unfortunately get hospitalized, I'm the person who's there in the hospital taking care of them, tweaking their discharge plans, and that gives a level of continuity that is hard to match. And then I think the other thing is we have all the resources of Children's Hospital at our disposal. So for us to see a child whose arm might be fractured, you know that you're going to walk right across the street. You're going to get your x-rays at Children's. They're going to be read by the best pediatric radiologists out there. And you're likely to go straight from our office to orthopedics clinic to see one of the best orthopedists in the country. And again, I think that that level of service is really important for a lot of our patients because it gives them both primary care but also easy access to the specialist.
When physicians join Longwood Pediatrics, they tend to stay here for the duration of their career, which is very nice, I think, for the families that come to Longwood Pediatrics to give them that continuity. And it also is very nice for the physicians that work here because we build lifelong relationships with not only people we call partners, but also friends.